time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, XL and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we when we link up. Let's go. Yeah.
Good morning, and happy Sunday. Welcome to another episode of Kidney Hub East Africa. I am half your host, Steve Belcher, also known as Steve the Kidney Nurse. What's going on, everybody? What's going on? How's everybody doing? So today, we have a great show for you. But before we start, I need to bring on my brother from Kenya, all the way from Nairobi, Kenya. It's about 8:10 p.m. in the evening. So let's give him a warm co-host introduction. My co-host, the Kidney Ambassador, Moses Kennedy. YouTube. Moses, what's going on? Welcome. How's everything going?
I'm good, Steve. I'm good. Once again, I'm glad we are able to have this show today. We need to apologize. Last weekend we missed it, but hopefully, and God willing.
We lost our broadcast with Moses, but he'll be back. If you're watching on YouTube or Facebook, share this broadcast. Share this broadcast, because what we're going to talk about today, okay, advocating for your health doesn't just apply for kidney patients, okay? This applies to all that seeks medical health. It applies. You don't have to have kidney disease to speak up or advocate for your health. You see it all the time. You see our sickle cell brothers and sisters, or our lupus brothers and sisters in the hospital going Facebook Live, talking about advocating for yourself because they're not getting the type of care that they deserve. So we have our brother back. Let me bring him up. Okay, Brother Moses, thank you for coming back. So
Thank you
again,
so much,
guys,
Steve,
we're
for having
live.
me.
Absolutely. We're live from Nairobi, Kenya, with Brother Moses, the kidney ambassador. I'm live from the nation's capital, Washington, D.C. So, Brother Moses, the topic today, advocating for your health, speaking up for yourself. As I was mentioning, it doesn't just apply to people on dialysis, but anyone that's dealing with a medical condition or who happens to see medical professionals. Now, in Kenya, how is the medical system, and is it hard to advocate for yourself over in Kenya?
Thank you so much, Steve. One thing I want to appreciate for choosing up and coming up with this topic. I didn't know how important it will be, but now I realize that it is as important to anybody else as patient on dialysis. Now, if advocacy is anything to go by within the Ministry of Health that is in Kenya, then I've seen it works best in mitigating other problems, say like cholera. Today, you know, at the moment we have cholera in other parts of the country. And then I also saw it work when HIV was being tamed. And then I saw it to corona. You know, ultimately, I know that even for renal disease, it is possible to put CKD into control. However, advocacy for oneself is something new, in that, you know, most of our facilities here in Kenya, as much as the government is trying, but then, you know, they are overwhelmed. Now, places all over within the country here, if you go seek for referral cases, say you want to see a specific specialty, maybe you want to see a cardiologist, or you want to see a urologist, or you want to see an orthopedic, you know, you get them to a referral hospital. Now, doctors might not have time to advocate for patients. Now, advocacy for oneself, I know now, falls in between here to ensure that everything goes right as possible, and even for better outcome. But then, you know, there are so many issues that is being associated with one's with self-advocacy. Number one, because most facilities, I've mentioned, they are overwhelmed here, the nurses or the health provider or health workers will see it as if there is a clash of interest, or like you want to teach them their job, you know, and then there could be a clash, you know, of within service delivery. In that,
right. Let me interrupt you for a second, brother, because
yes,
you said something very important about if you say something, because it happens over here. Like if you say something to the healthcare worker, it may be a clash. Same here. You have some warriors who may be at treatment, and they say something to the technician, about something pertaining to their care, they may say something, they may not, in fear of, I don't want to say retaliation, but that they may treat them differently. And that moves on to what I'm about to read. That's why it's important, is what you just said about speaking up. And some warriors may fear because of, they say something to the healthcare worker, there may be a clash. But the literature, like being comfortable with your healthcare team, that's very important. Being comfortable with your healthcare team and actually knowing what your care consists of. That's vital to your health and safety. And it goes across the board with not just kidney disease, but with anything. You got cancer, sickle cell, chronic illness, whatever one is dealing with, being comfortable with the healthcare team, right? And actually knowing what your care consists of, not just sitting back, letting them do everything and not asking questions, but actually knowing what your care consists of. What's that? What's this? What does it do? How does it help? That is vital to your health and safety. And a lot of people these days, the fast movement of healthcare, everything else that's going on in one's life, these type of shows don't appeal to a lot of people, Brother Moses, especially here in the United States. You know, until it actually happens to oneself, then that's when one puts into action to try to do something about it or seek immediate information to find out what's going on with themselves. And then some people don't even care. And that's why you have 9 out of 10 people here in the United States with stage 3 kidney disease and don't even know it. And there's 5 stages. So if you at stage 3 and you don't even know it, Brother Moses, more than likely you're going to fast track to stage 5 sooner than later. Or it may not even happen. But if you're at stage 3, you got to figure out what brought you to that point and then do something about it to stop the progression. But if no one is being comfortable or feeling comfortable with their doctor and asking questions and knowing what's going on, then it's the same old status quo. And so understanding what your healthcare provider, whoever that is, or if you go to dialysis, your dialysis facility tells you, understanding that information will help you take better care and protect yourself. What do you think, Brother Moses?
Absolutely true. I agree with you.
What do you
How
think,
important
TikTok?
how important it is to advocate for oneself, because it has a lot of it comes with a whole holistic benefit in that better outcome, disease control, I mean, name it. But then, I want to give a scenario here in Kenya where we have the private hospitals, private facilities, and the government facilities. I know the case is different over there in the US, Steve. In Kenya,
yes,
government facilities are poorly managed compared to private sector. However, private sector is purely for those who have money. And most of our specialty, they'll rather work in a private facility whereby they can charge consultation, they can see patient privately. Unlike in a public hospital where the facilities are crowded and the workforce is overwhelmed, that is why you see the space of oneself advocating for oneself becomes a challenge. I know it is something that ought to take root, but then we must tell our patient that what come may, then it is very important to advocate for yourself.
Absolutely, absolutely. And it's the same thing here. We have public hospitals where some patients have to go, and they have other hospitals, but it doesn't matter what hospital you go to, whether it's public, private, whether you're here in the United States, over in Kenya, or any parts of East Africa. It's important to ask questions and understand what's going on with your health, especially for our warriors on dialysis. It's very, very important that, especially if you start or if you just started or last month, 6 months ago, it's important to ask questions and understand your medications and your diet. That's a big importance when it comes to patients dealing with kidney failure. Regulating the medications and diet. Because we know that the diet, if you have something high in potassium, could possibly impact you, affect your heart, cardiac arrest. That's why asking questions and understanding this is so critical to one's health. Again, it doesn't just have to apply to kidney disease, okay, or kidney failure. You can equate this with any other illness or condition if you happen to be watching and you're like, no, guys, I don't have kidney disease or any of that. I'm dealing with maybe diabetes, or I'm maybe dealing with sickle cell, or maybe dealing with this or that. Well, you just use the same information and just use it to your situation, apply it to your situation. So that's why this is important for a lot of people. And a lot of times, a lot of people don't hear information like this. We got one person watching on Facebook or YouTube, and like 10 on TikTok. When I first started, went up to like 200 something. And I was playing the music and all that. Then when they got down to the meat and bones of the conversation, it leveled off to, like I say, right now, like 10 people. But that's neither here nor there. What's important is the information and it getting out there. Because you can have somebody watching right now and then go to treatment tomorrow, whether it's dialysis or wherever they're dealing with, and could be confronted with a situation where they need to advocate for themselves, but they don't know where to start from. And then they leave out feeling like I should have said something. Or maybe I had a person reach out to me, Moses. I'm going to give you a scenario. I had someone reach out to me the other day that's part of a group. They called me up. They text me, asked me, can I call you? I say, yeah, call me after 5 on Friday. So I get off of work, right? 5 o'clock, the person calls me at 5:03. I'm like, wow. Like, you didn't give me enough time to even get off to decompress. But again, that's neither here nor there. But they called and they were saying that they had an issue with their arm. Their arm clotted. And so they got a catheter. And so now they want the person to go to the other arm. And the person, they got small veins, and they want to put a graft in the other arm. And they say that's the only arm they have left with strength and able to do stuff. And they don't want to do it right now. They want to think about it and get a second opinion. But he's feeling pressured. And you have a lot of people who feels pressure and don't know what to do. And so they may have to hear from somebody else like, look, let's slow it down. This is your body. Number one, this is your body. Can't no one else tell you? They can give you information and give you the risk and benefits, and then you make that decision. But can't nobody make you go into that hospital and get surgery. That's something that you have to sign and agree upon. But I feel like a lot of times these healthcare providers, they try to invoke make you feel guilty, saying, you know, you can get an infection or you can possibly die having that catheter. Something to get you to move faster than what you're ready for. And I told the gentleman, you should seek a second opinion. Got some people saying they can fix it, and then the regular surgeon saying they can't fix it. So you got two differences of opinion. The person is in the middle. And so this is a time where advocating for yourself, asking questions, finding out what's going on, why they want to go on the other side, why they can't use the same. Don't just let them cut. That's what you see people here ended up with 3-4 accesses. One here, one up this arm, one down here. Now it's in the leg. So it's very important to ask questions and understand what's going on with your condition. And for a lot of people, if you're watching, excuse me, and I'm going to pass the mic to Brother Moses. If you're watching, regardless if you're in East Africa or you're in the United States, don't be afraid to actively take part in everything about your care. Again, you don't have to be on dialysis or have kidney disease to actively take part in everything about your care. What do you think about that, Moses? Do you think some people are afraid to actively take part in everything about their care?
Absolutely, Steve. I do agree with you how important it is. But then some of the most patients normally get attached to maybe their doctors or for dialysis is nurse technician, and maybe when they talk to them, hey, why can't you change the gloves? Personally, I've had problems because as an advocate myself, I always know what is supposed to be done. Now you realize the moment you say, oh, nurse so-and-so, can you just have some new gloves before you even prep machine? Then one will tell you, oh, Moses, so you know better than I do. Okay. And that back and forth. So it makes some patient shy away from speaking up. But Steve, this is very important, and this is why we are discussing this topic today, that let every warrior or every patient regardless of what he's suffering from, that it is his rightful duty to be his own advocate.
Absolutely. In fact, I say it is one's job to help take care of themselves and take charge of their own health care. One has to do that if you want to be in front of what's going on. Again, I feel that it's one's job to help take care of yourself and take charge of your own health care. Because if you don't do it, no one else will. No one, you go get prescriptions for something, or the doctor, they want you to do it, and some people just go along with it. And then you have some people want to know every step of the way. Why? Why you want me to do this? What's going to be the benefit for me? So you want to know the benefits of your outcome. So I was looking at something, what is going on with your personal health care, the chance of error is much. So again, if you, not you, Brother Moses, but if one doesn't know what's going on with their personal health care, right, the chances for errors, medical mistakes are much higher. And point in case, let me give you an example, a simple one. Say if you are allergic to penicillin. Here in the United States, you got a lot of people, including myself, is allergic to penicillin. But if you don't know that, and you go get a dental procedure or get some type of antibiotic therapy, and they administer you penicillin, but they forget to ask you, do you have any allergies, or are you allergic to penicillin? Then you take the penicillin. Next thing you know, you go in the bathroom, you got blood in the urine, or you got these hematoma or blood spots on your legs or whatever. And you're like, what's going on? And, one doesn't have any medical history, so you don't know what's going on. Now you got to go to the doctors or to the emergency room to figure out why you got blood in your urine or why you having these other type of symptoms, not knowing that it's related to the penicillin. So that's what I'm saying. If one doesn't know what's going on with their own personal health, that could possibly be detrimental in the future if they got to receive any type of medical care and they don't know their allergies. What do you think, Brother Moses?
Absolutely, Steve. And this one is really important, more so to those with chronic diseases, because managing such diseases, lives or long-term diseases, it requires a journey. I've been to an hospital and no one knew that I'm a dialysis patient. So I saw another patient. They want to prick the same arm where the fistula is. I was telling them, hey, look, you're about to puncture this fistula. And then they were like telling, hey, and whose capacity? You're speaking as who? So sometimes
they're pretty much telling you to mind your own business.
Yeah, yes, actually. So sometimes it is very important to ensure that even the healthcare provider knows that a patient has a right for self-advocate. Very important.
Absolutely. Absolutely. And pretty much one would have better and safer care if they just speak up or advocate for themselves. I believe the outcome would be a lot better. And it doesn't matter if you're comfortable with the person. For instance, if you're on dialysis and you have a nurse
Yes.
coming to give you medicine, there's nothing wrong to say, is that so and so? Like if you're getting, say, Epogen, is that my Epogen? Yes. Is it 3,000 units or how much am I receiving? Instead of just, they give you the medicine, you're not knowing what they're giving you. So people, again, whether it's kidney disease or whatever you're dealing with, have a role in the safety of their own health. We all, myself, I got kidney disease. I have a role in the safety of my health care, as well as Brother Moses and anyone else that's watching this program that's dealing with chronic kidney disease, diabetes, hypertension, lupus, sickle cell, cancer, whatever chronic illness one may be dealing with, they have a role in the safety of their own health care. Because if you don't play a part, then it almost like giving the provider permission to pretty much do anything, far as write anything, try anything. And you're like, wait a minute, no. We gotta, try something else, especially if something's not working. It's always good to seek a second opinion. Because maybe the first opinion you may not agree with. And they say, person go back to the same surgeon that messed up their first surgery. They go back and they mess up the third surgery.
True.
So you got to get a second opinion. So Brother Moses, as I was speaking with you, there's an acronym for when you're advocating for your health that's used called Speak Up. And they break it down. Each letter means something in that word, speak up. So we're going to begin with the S in speak. So in speak up if you have questions or concerns. And if you don't understand anything, ask again. Keep asking till you understand it. Even if they got to break it down to where a 6-year-old can understand. Ask again. It is your body, no one else's. It's your body. And you have a right to know what's going on. Point in case. Don't be afraid to tell the nurse or doctor if you think you're about to receive the wrong medication. Or to tell them about an allergy, which I mentioned before. Like, if they don't know you have an allergy, that could be a big error in giving you medicine. Also, don't hesitate to tell the healthcare professional if they may have you confused with another patient or something you don't agree with. Don't hesitate. What are your thoughts on that, Brother Moses? Okay, it seemed like we may have lost Brother Moses. So we're having some internet connection issue. So until Brother Moses come back, I'm going to continue speaking. So as I said, don't hesitate to tell the healthcare professional if they got you mixed up with someone or they're about to do something that you've never seen before. Don't hesitate. All right, we got Brother Moses back. Also, your safety is too important to worry about embarrassment or hurting someone's feelings. Like you want to say something to someone, they're not washing their hands. Right? I don't want to say nothing. I don't want to hurt their feelings. No, your safety is too important not to. See somebody got the same gloves on walking over to you, get ready to do something. That they're supposed to change gloves and wash their hands or use hand sanitizer before coming to working on a new patient. But if you see somebody in real time just finished doing something, having on the same gloves, and they coming now to work and clean your arm, don't be embarrassed to say, hey, can you change your gloves, please? And then if they give you some attitude, say, okay, look, I want to speak to the charge nurse. Then they got to go get the charge nurse. Say, look, this is what's going on. Again, your safety is too important to worry about embarrassment or hurting someone's feelings. And see, we lost Brother Moses again. The internet is real tricky. I don't want you to hear the information. So when we move on to the P of speak up, the P stands for pay attention to the care you are receiving, whether it's doing dialysis or anywhere else. Don't assume just because it's routine, it's always correct. And you see that a lot of times in the dialysis facilities. You see people doing the same thing. Doing this, doing that. And maybe changing gloves and maybe not. Don't assume just because it's routine, it's always correct. Again, pay close attention to the care you are receiving, whether it's at dialysis or your regular doctor's office. Okay, again, this is not just for kidney warriors or people dealing with dialysis, this particular topic, even though the name of the show is Kidney Hub East Africa. Okay? Not going to get this type of information on a Sunday morning or Sunday afternoon here in the United States, Sunday night in East Africa. So, Brother Moses, I know you had some difficulties with the internet, but I had moved on. But I want to go back because I started with the S and speak, and speaking up if you had questions or concerns, and then I ended off saying that we lost them again. See, the internet over there is not stable. That's why it's hard for our brothers and sisters in East Africa to get life-saving information like this because of the instability of the internet. Okay? Now, I talked about paying close attention with the P and speak up. Don't assume just because it looks routine that is always correct. Ask questions. So now I'm freezing up on my live. Let me add Brother Moses back. Okay, Brother Moses, we have moved on and talked about paying close attention to your care that one is receiving. And don't assume just because it's routine that it's always correct. Do you have anything to add to this?
I can't hear you clearly.
Do you have anything to add to what we just discussed about speaking up if you have questions or concerns?
I can hear you now, Steve.
Do you have any comment to what we just talked about?
Well, not at the moment. Let me. Can you hear me, Brother Steve?
Yes, sir. Yes, sir.
Can you hear me?
Yes, we can hear you.
All right, all right. I can hear you now.
Yes. Do you have any comments on what we talked about speaking up for yourself?
Well, just I'd mentioned speaking for oneself. Many a times it could.
Okay, looks like he's still having his internet issues. So let me just move on. So make sure wherever you're at, I don't care if you're at the plasma place giving plasma, make sure the health personnel that's caring for you wear gloves and uses hand sanitizer or washes their hand. Okay? That's anywhere. You see, now we done got laxed. We done got real lax. You remember when COVID first came out? People was walking around with garbage bags on, these contraptions, you know, Fendi mask, you know, can of hand sanitizer, wiping the doors off when they open up. All this back when COVID first came out. And here we are, like 3 years later, like nothing happened. Got people now, hospitals, they dropped the rules for wearing masks in some hospitals. And the hospital is the biggest place where you get an infection. And so now people again got their guards down. I'm still wearing my mask. And I go into any indoor place where there's a large amount of people or it's congested. You got darn right I'm going to have my mask on. Got people still coughing, not covering their mouths, coughing in their hands, open up the doors. No one's wiping them down anymore with the Lysol wipes. It's like we done gotten laxed. So make sure, especially at dialysis or anywhere you're receiving any type of care that they got to touch you, make sure they are changing gloves, washing their hands with soap and water, or using hand sanitizer. Okay? Now, as we move on to the E of speak up, educate. You say, Steve, educate. Yes, educate yourself about your condition. Whether you got chronic kidney disease, diabetes, hypertension, lupus, sickle cell, any chronic condition you may be dealing with right now, if you're watching this, and if you haven't already done so, or maybe your loved one, maybe you're a caregiver of someone who's dealing with one of these conditions. Educate yourself about it. Gather information about your condition and treatment options. And we always say this to dialysis patients, warriors. You got kidney disease and you're at stage 4, stage 5. You're just finding out. You don't know what to do. This is the time for one to gather information about the condition you're dealing with and what are the treatment options if it happens to get to that point where you may need dialysis. See, a lot of people, Brother Moses, especially here in the United States, they get caught off guard. Absolutely. Right, having kidney failure. They may go in thinking something else is going on. Then the doctor comes out and says that their kidneys have failed. Now that's a big disruption now. Now they got to figure out what they're going to do about this, what they're going to do about that. But if you know you're dealing with a condition and you're treating it, and for some unknown reason, it may develop into kidney failure, well, at least you know information beforehand so you know how to deal with this once it should happen. You got everything lined up. You know how, like if you're working, right? And you can't stop the progression. And you see it coming, absolutely. But you're in front of it. If you're working and you want to continue to work, then now you can say, oh, if it does happen or when it gets to that point, I can do home dialysis and continue to work. I don't have to be caught blindsided. And now I got to figure out what I'm going to do about my job. I'm in the hospital. I don't know what I'm going to do. I don't know anything about dialysis, the treatment. You get out the hospital, you go to the outpatient center, and you need this particular shift. You can't get that shift because it's not available. Now it's like, what do I do? How do I work and do dialysis? Not knowing that you can do home dialysis. That's why it's so important to educate yourself. Your thoughts on that, Brother Moses?
Very true, Steve. Sometimes...
Oh, man, we lost him again. Man, The Wi-Fi is unforgiving in Kenya. This is what our brothers and sisters are going through. But we determine here at Kidney Hub East Africa to get the information out there. They may stop him, okay? But they can't stop the information. And so, as I mentioned before, educate yourself about your condition. Also, gather information about your treatment options as well. So we frozen on YouTube and Facebook. I am totally frozen. Let's see. Okay, we're back. All right, Brother Moses. I mean, we can't keep having these interruptions because I be on the road and then your internet goes out, unfortunately. So what was you about to say, brother? Uh-oh, it looked like we have issues with this speaker. So let me move on. So as I was mentioning about educating yourself, be sure, this is very important, all right? Be sure to read all medical forms and information before you sign anything, okay? Be sure. Now, we know a lot of this information is, in medical jargon. So that's why it's good to have an advocate, and we're going to talk about that. But be sure to read all medical forms and information before you sign anything or leave the office, right? Or the dialysis facility. Especially if you have questions, and to make sure that you understand everything that's going on. Because a lot of warriors, especially on dialysis, when they sign the consent form, it's about this thick of papers. And we ask you, get your signature, your initials, your signature, your initial. And then for a lot of people, they take the information and they may not get a copy of it. If you don't ask, they're not going to give you a copy. So now, all these papers you sign, you're not going to remember. For the average person is not going to remember all the forms that they sign. And one of those forms, the consent form, tells you everything that can happen to you on dialysis. So patient, something happened, person gets infiltrated, where the needle goes through the access and their arm swells up. Be like, I want to sue. Like, no, you can't sue. I want to sue. You infiltrated my arm, you messed it up. But in the consent form, it talks about being infiltrated. That's one of the possibilities. And you sign to that. So, again, read all medical forms and information before you sign anything or leave the office or dialysis facility in case you have questions and to make sure you understand what you just signed. See, all patients, when they start dialysis, they got to sign a consent form. All patients. That's why if you're watching this and if you're on dialysis, this applies to you because you had to sign the form before starting outpatient dialysis. Whether you do home dialysis, peritoneal, you had to sign the consent form stating what can happen, what's this about, what is your role. So if you didn't get that consent form, ask them for a copy. Now let's move on to the A and speak up. A stands for ask a trusted friend or family member to be your advocate. You may not can't do it alone. You may one day feel like, hey, I don't even feel good. I don't even feel like talking or even bothering dealing with this. So that's where the advocate pops in. A trusted friend or family. Now they can ask questions you may have forgotten. You hear some warriors say, oh, I deal with this fog in my memory sometimes. So you may, before you go to the doctors, have a bunch of questions in your mind that you want to ask, and then you get there, it's something I wanted to ask, but I can't think of it right now. So that's why you either write it down, you take this list with you, or you write it down and give the list to your advocate, because you can write it down, have the list, and forget the list. Forget the list. You walk out the office, you get home, you go in your pocket, you pull out the list, be like, damn, I forgot to ask the questions. So again, ask a trusted friend or family member to be your advocate. You can be your advocate as well, but you need a side partner, as they call it in Top Gun, a wingman, to watch your back. Or they say in the street, your partner, or your partner in crime. You need someone there to act as your advocate, that wingman. Okay. Now, also be sure this person, your wingman, your sidekick, Ace Boon Coon, whoever you want to name, your cousin, your beastie, make sure this person understands your treatment and preferences. That's very important, because if you can't speak for yourself, this is when that person steps into that role of being your advocate. Brother Moses, we got you. Any words? We keep losing you. So do you have anything, or can you hear me right now? Brother Moses, can you hear me?
I can hear you, though not clearly.
Please, do you have anything to say before we lose you again? Do you have anything to say before we lose you?
I can't. I don't know whether it's from your end.
Brother Moses, can you hear me? Okay, let me move on. Okay. All right. My apologies for this internet instability that we're having with Brother Moses. We're always glad to have him to get a perspective from our brothers and sisters in East Africa. But there are challenging times where we're dealing with instability of the internet there. Okay. Again, whoever you ask to advocate for you, okay, be sure this person understands your treatment and your preferences. Now, as we move on to Kay and speak up, know what medications you take and why you take them. Okay? Because a lot of times, not just with our kidney warriors, but many patients that go to doctors, their primary care, maybe their endocrinologist, cardiac doctor, whatever doctor you may be seeing. Doesn't have to be a kidney doctor. Know when they write, oh, we're going to give you this. Don't just say, okay, put it in your pocket and leave out and then take it to the drugstore. Now they typing it in and sending it directly to the drugstore. Okay. Know what medications you take or are being prescribed and why you are taking them. Also find out for how long. How long you want me to take this? Don't just, again, accept the prescription, go get it filled and just take it to be taking it. Ask questions. Because look, medication errors, yeah, there are medication errors, are the most common type. The most common type of medical error. So it's common to have a medication error. So again, know what medications you are being prescribed, you take, why you're being prescribed, why you're taking it, and the risk. Or as we say in the nursing field, contraindications, side effects. So as you know what medicines you are taking, always have a current med list. What you're taking, how much? I'm taking Procardia, 10 milligrams, 2 times a day. Or I'm taking gabapentin, this many milligrams, PRN for pain. So always have a current medication list, either at home, keep one at home, in your car, or on your person, like your wallet. In case you have questions or you go to the emergency room or any type of medical facility and you need treatment and they need to know what medicines you're taking. A lot of people are like, I don't know. I don't have my list. Some people get to the hospital. Well, they've been giving me this at home. Why you can't give it to me here? Well, they don't know. That's why, again, your medicine list is very important. And it's definitely good, again, just in case you had to share it with other medical personnel. Also, important, be sure to tell about any allergies you may have. Some people are like, Steve, I don't know if I got allergies or not. You may need to go see an allergist to find out if you have any type of allergies. But there's so many, one is not going to know. But if you find out, like if you one day you went to the doctors or a hospital and they did something, gave you some medicine, and you start having some problems as a result of the medicine, then you know you're allergic to that. I don't care if it's food. I don't care if it's peanuts, shellfish. They need to know that stuff. Try to bring back our brother so he can hear me. I know we're having issues with his mic. Can you hear me, Brother Moses?
I can hear you clearly now.
Please, if you have anything to say, now would be the time to say it, because we're about to close out the show in about 5 minutes. So if you have anything important to say about what I talked about, please share that right now.
Well, in short, self-advocacy comes with a lot of benefits in it. It comes with the benefits outweighs not advocating. So it is of beneficial for everyone who goes to see a doctor to know and to ask and to seek second and even third opinion. Because look, you have to choose. You either compromise or if you compromise, then you will face the consequences. For example, if you cannot guide your health provider on hand hygiene, that is sanitation, or one patient, one glove, it is you who will suffer the consequences. You will be prone to infection, and of course, you will go the financial loss and the burden. Very important, Steve. I want to encourage each one of our viewers to be an advocate of themselves.
That's it. Okay. Well said, Brother Moses. Let me just add, if you're watching this doesn't pertain to our brothers and sisters in East Africa, but here in the United States, if you are a caregiver or you're one about to start dialysis, or you just started dialysis and you want to find out information about your facility, you can go online to www.medicare.gov/dialysis compare. And right there, this can tell you what facilities are Medicare certified. You can get location, the shift times, what time their shift starts, the type of dialysis that they have, and also see where they rank with Medicare. And also in the P, that was use dialysis compared. That's the U and up and speak up. And the P, the last of the word, speak up, participate. And this goes to our brothers and sisters overseas as well. Participate in all decisions. I can't stress this enough. Participate in all decisions about your treatment. If the doctor going to increase the time or lower the time, find out why. The dietitian changes your calcium medicine or your Sensipar, whatever vitamin D. You used to get 1 pill, now you see 2 or 3 pills. Ask questions, participate. Why did you increase the medicine? Why did you decrease the medicine? Why am I on a new filter? Why is my blood flow rate decreased or increased? So definitely participate in all decisions about your treatment. Basically, you are the center of the healthcare team. All of it involves around the person dealing with the situation. Another thing, keep copies. Again, I can't stress this enough. Keep copies of your healthcare records from all hospitalizations for your doctor and facility, but not only for them, but for yourself. So you can have an archive of information of your treatment and how they were dealt with in the past. Okay? Also, as we end this, ask these 3 questions. There are 3 questions you want to ask when you get information about your care. Those 3 questions. 1, what is the main problem? What is the main problem? Number 2, what do I need to do about it? What do I need to do about it? And 3, why is it important for me? So you get information about you got kidney disease. That's the main problem. You got kidney disease. What you need to do about it? You need to find out what caused that kidney disease and change your situation, whatever it is. If it's from diabetes, control your blood sugar, change your lifestyle, hypertension, because these are the 2 leading causes. Control that blood pressure, change your lifestyle, change your diet, exercise. But if it's genetic, there's only so much you can do. But you can learn about the condition, polycystic, that's genetic. What you need to do about it, whatever you need to do to hope or to make sure these cysts don't develop or grow. I mean, there's certain medicines out there that they use to help suppress cysts. But even with other genetic conditions, trying to learn more about that, like FSGS, and why it's important for you. And I mean, remember, this is your life they are caring for. So it's very important to speak up and to advocate for yourself. Any departing words, Brother Moses, as we close the show?
Absolutely. Let me just add one thing.
Sure.
The most important thing to bear in mind that sometimes, because chronic kidney disease is a journey that will take you a long time, or years or months or several years, there is tendency of the health providers working on a comfort zone, in that it is just a formality or a kind of a ritual that you just go, they ask you, how many kgs you've added? Oh, it's 2. Okay, 4 hours. That is why we are saying, as warriors, that we must be advocate for our own health.
I agree with you, Brother Moses. I agree with you 100%. 100%. So, with that being said, we like to thank everyone who joined the show and watched the broadcast, Kidney Hub East Africa. Again, we do this every Sunday as time allows, from 1 to 2 p.m. Eastern Standard Time, USA, and from 8 to 9 p.m. East African time. We went over the show today. We had some connection issues, but we were able to make it through the show without stopping it. So I'm very happy about that. So, Brother Moses, again, thank you for coming on. We look forward to seeing you next Sunday at the same time, same place on Kidney Hub East Africa. And I'm sure we will have another great topic to speak about. Any last words, Brother Moses, before we go?
Thank you so much, our viewers. As I've always said, same hour, same time, every Sunday. We will not disappoint you. Always try as much as possible to forward topics that you would want Steve to discuss, and your shares and thoughts to how to improve also this project. And ideally, feel free to be part and parcel of this progress. Thank you so much.
Absolutely. We thank you guys. Thank you for joining Kidney Hub East Africa. We see you guys next Sunday. Brother Moses, we'll talk soon. Take care. God bless you. And please share this broadcast, guys, to anyone who's dealing with any type of condition that you feel can use information on advocating for your health. With that being said, God bless, and we see you next Sunday on Kidney Hub East Africa. Good night.
Thank you very much.